first of all, let's talk about royalties.
That's the question. No, that's the question. Have you
Senator,
have you ever received a royalty payment from a company that you later oversaw money going to that company?
You know, I don't know as a fact, but I doubt it.
Can you tell me if anybody on the vaccine approval committees ever received any money from people who make the vaccines?
Soundbite number one, are you going to let me answer a question?
When people decry vaccine hesitancy, it's coming from the gobbledygook that you give us.
As a matter of fact, Reuters fact check looked at that and said Fauci's 2004 comments do not contradict his pandemic stance.
Actually, words don't lie.
I have never, ever denied fundamental immunology. In fact, I wrote the chapter in the textbook of medicine on fundamental immunology.
If you look at the countries that Russia has attacked over the last years, Georgia, leaving forces in Transnistria and Moldova, and then repeatedly Ukraine, these were countries that were not part of NATO. It has not attacked NATO countries for probably a very good reason.
You could also argue the countries they've attacked were part of Russia.
Well,
we're part of the Soviet Union.
Yes, and I firmly disagree with that proposition. It is the fundamental right of these countries to decide their own future and their own destiny. And
I'm not saying it's not, but I'm saying that the countries that have been attacked, Georgia and Ukraine, were part of the Soviet Union.
And that does not give Russia the right to attack them.
And they were part of the Soviet Union since the 1920s.
But that does not give Russia the right to attack them. On the contrary,
no one's saying it does, but it
they were
really has
liberated
nothing to do
from being part of this empire by force.
We'll have no budget this year. How inexcusable, how embarrassing it is for a country, the largest country in the world, the largest government in the world, the largest bureaucracy in the world, to have no budget.
So what this budget resolution brought forth by Senator Paul does is exactly the opposite of what we should be doing. Instead of expanding Medicare to make sure that every man, woman, and child in this country has health care as a human right, this is a budget that would lead to devastating cuts to Medicare, cuts to Medicaid, cuts to other public health programs. And Senator Paul's budget, well, you guessed it, you're right. He would give even more tax breaks to the 1% and to the billionaire class. Unfortunately, the vision of America that Senator Paul's budget puts forward, balancing the budget on the backs of working families, the elderly, the children, the sick, and the poor, in order to make the richest people in America even richer, is not just the vision of Senator Paul. I wish it was just his vision, and I got to applaud his honesty for coming forward and putting his vision on paper. Unfortunately, it is the vision of many, many people in the Republican Party. And this is what they want. Senator Paul and many in the Republican Party do not believe that it was good enough to provide over $1 trillion in tax breaks to the top 1% and large corporations, as they did when Trump was president. Not good enough. The budget that we are debating today, Senator Paul's proposal, would make those tax breaks for the wealthy and the powerful permanent at a cost of more than $2 trillion over the next decade.
And so if she really has the flu, she definitely doesn't need a flu vaccine. If she really has the flu,
she should not get it again.
No, she doesn't need it because it's the most potent vaccination is getting infected yourself.
So when we look at this, we wonder, why you seem to really embrace basic immunology back in 2004 and why you seem to reject it now.
Well, I don't reject basic immunology, Senator, and I have never denied that there is importance of the protection following infection. And that film that you showed is really taken out of context. I believe that was when someone called in who had had a reaction to a vaccine and asked me through a telephone in the interview if they should get vaccinated again. So it was in the context of someone who had a reaction.
If you look at the words behind me, we can go over them a little bit at a time. She doesn't need it because the most potent vaccination is getting infected yourself.
It is true. It is true, Senator. It is a very potent way to protect.
So when you're trying to tell us that kids need a third or a fourth vaccine, are you including the variability or the variable of previous infection in the studies? No, you're not. And you will have to divulge where you get your royalties from what companies, and if anybody in the committee has a conflict of interest, we're going to learn about it. I promise you that.
Hey, can I respond to that, please?
May.
Okay, there are two aspects for what you said. You keep saying you approve, you do this, you do that. The committees that give the approval are FDA through their advisory committee. The committees that recommend are CDC through their advisory committee. And you keep saying, I'm the one that's approving a vaccine based on certain data. So I don't really understand, with all due respect, Senator.
You're the one that said you would not reveal what companies gave you royalties or what company gave the other scientists royalties.
Gotta move
That's
on.
what you told the committee.
Senator Paul,
Sir,
you got to move on.
Could I please answer that?
Briefly,
You
yes.
keep asking committees. They're not my committees. They're the VRPAC committee for the FDA and the ACIP for the CDC. So I don't have any idea what goes on.
And they
with
won't
the
reveal, as well as you won't reveal
Okay,
what
we're
companies
gonna
you got.
move on. We're over time.
Well, first of all, let's talk about royalties.
That's the question. No, that's the question. Have you
Oh,
ever
no,
overseen, have you
Senator,
ever received a
you're
royalty
playing-
payment from a company that you later oversaw money going to that company?
You know, I don't know as a fact, but I doubt it.
Well, here's the thing is, why don't you let us know? Why don't you reveal how much you've gotten and from what entities? The NIH
Okay,
refuses. Look, we ask them. The NIH, we ask them whether or not, who got it and how much. They refuse to tell us. They sent it redacted. Can you tell me if anybody on the vaccine approval committees ever received any money from people who make the vaccines?
Soundbite number one, are you going to let me answer a question? Okay, so let me give you some information. First of all, according to the regulations, people who receive royalties are not required to divulge them even on their financial statement, according to the Bayh-Dole Act. So let me give you some example. From 2015 to 2020, the only royalties I have was my lab and I made a monoclonal antibody for use in vitro reagent that had nothing to do with patients. And during that period of time, my royalties ranged from $21 a year to $700 a year, and the average per year was $191.46.
It's all
Get that,
redacted, and you can't get any information on the 1,800
Senator Paul,
scientists.
your time is
So
long.
we want to know
Senator
whether or not
Paul.
people got money from the people who made the manufacturing.
Senator Paul, your
vaccine.
time is long over expired. I gave you an additional 2.5 minutes. The witness has responded. We are going to move on. Senator Sanders.